Varicose and spider veins are often overlooked as just a cosmetic flaw, but they can actually be signs of more serious problems. Here to explain is Dr. Dale Payne, cardiothoracic surgeon at Arizona Vein and Laser Institute. Great to see you.
Nice seeing you too, Gina.
So, Dr. Payne, what are some of the signs and symptoms of varicose veins?
You know, people who have varicose veins usually know that, but there's a variety of varicose veins. So there's the ones that are bulging, there's the ones that are ulcerating, and then there's spider veins.
Okay.
The spider veins, of course, are the ones that either look like spiders or they spread out like a spider web and on the superficial portion of the skin. The other varicose veins are the deeper ones, and the ones that look like almost like a rope sometimes, and they can be tender, and all of these veins can be tender. They can cause the legs to swell, and people also complain of some restless legs at night, and sometimes some itching.
So when we see these things on our legs and we're not really sure, you know, how can we kind of find out if it's a varicose vein versus just something cosmetic?
Well, you know, they could come in for free screening.
Mm-hmm.
That's probably one of the easiest ways. They can go on the internet and look at what a varicose vein actually looks like. They can go to our website and also get that information. Sometimes the easiest way is just to come in and ask, and we can help them with any questions and tell them. We have just a wonderful staff. It's a very competent, wonderful staff on all of our clinics.
And what are some of the treatment options for the varicose veins? Because there's a lot of different things you can do now.
Exactly. We specialize in endovascular laser therapy for the deeper veins, the veins that cause some of the symptoms and problems.
So similar to what we're seeing here, right?
Exactly. What we're seeing on these screens is sometimes what causes these varicose veins. The pressure that builds up, and a lot of it's genetic, some of it's after childbirth, some of the things make it worse with those particular problems. But valves can leak, and when they leak backwards, they go down to the next valve, and they can leak, and they go out into the branches. And the branches are what causes the varicose veins and the spider veins. But these are all treatable.
And this is the laser treatment here and how that works. So the laser's inserted into the vein?
Exactly, under local anesthesia. It's inserted into the vein, a little further down on the leg, and then inserted a little further up the vein under ultrasound guidance. And the rest of the anesthesia is given locally to surround that vein. And when we turn on that laser, it gets hot at the tip, and we pull it back slowly, and it destroys that vein.
So what's the downtime for something like that?
Most people can go back to work the same day. The same day.
Wow.
Exactly.
And how about with recovery? Is it pretty fast?
It's very fast. We recommend, and most people do recommend, using some type of compression hose.
Okay.
For 2 weeks after a laser treatment. We'd like that vein to heal flat. If it heals open a little bit, blood can get in there and cause a little clot. That will eventually go away too, because there's no further flow in that vein. But it takes longer for the results to be seen. But if it heals flat with the compression hose, then we get the results much, much quicker.
And so if someone's having some symptoms now with veins, how soon should they get treatment?
This is not an emergency. This is not something that somebody has to rush in someplace and have treated. And it's optional how fast they want to have it done or whatever. When it does become an emergency is if you have some ulceration at the ankles. And some people who have diabetes, that can get infected. Sometimes areas around the ankles and the legs from the venous insufficiency. It's called venous reflux or venous insufficiency, can bleed and get infected. That becomes more of an emergency. And
you guys do a free consultation, right? A free screening for people as well. Yes. And then you've got a free car service?
Well, for seniors, especially for people who can't get down to the clinic. We have free shuttle service that brings the people to the clinics.
All right, and you have locations throughout the valley.
Yes, we do. We do now have 5 locations, and they're pretty convenient for just about everybody.
All right, so you're making it easy for everyone to get there.
We're trying. We're trying to make it easier.
There's no pain in this, Dr. Payne.
Just Dr. Payne.
Thank you so much.
No, you're very welcome. Thank you, Gina.
And if you'd like more information on Arizona Vein and Laser Institute, you can log on to their website, ArizonaVeinandLaser.com, or call either of the numbers that you see on your screen.